Yeah.
Yes, sir.
Chalo, anyway, yeah, thank you. Anyway, very good afternoon. Last class, I told you about a very simple remedy. Now, this is one remedy which we very often use in our clinic. Okay, meaning acute cases only. This particular remedy we very often use. I shared two small cases. Both the cases that you saw were, or those two cases, what you saw was the main area was the JT. In one small girl, you saw colic, and one more young lady, we saw diarrhea. Okay, and in both the cause was suppressed anger. Fine. So that's what we saw, and we also spoke of mentals, and I gave you the meaning of different terms. Indignation ಅಂದ್ರೆ ಏನು, mortification ಅಂದ್ರೆ ಏನು, vexation ಅಂದ್ರೆ ಏನು, chagrin ಅಂದ್ರೆ ಏನು. So these are few things that we discussed. Okay. If you have any quick questions related to what we spoke, ಏನಾದರೂ ಪ್ರಶ್ನೆಗಳಿದ್ರೆ I'll be happy to take up the questions. Or if there are no questions, then let's not waste time. We will start with the remaining part of Colocynth. Okay. No questions. Okay. Okay, chalo. See, no questions. Yeah. Generally, any teacher will tell when you say no questions, there are two options. One you have completely understood, and one you have not at all understood. Okay. So on a positive note, we'll go with the first option. I assume you have completely understood. Okay. And then we will start with the leftover part of Colocynth. Mind, sphere of action, and ailments. Three small things we spoke in this remedy, I mean in Colocynth. So we'll focus on the remaining part. See, when I say the remaining part, next 40 minutes or 30 minutes, I'll be concentrating exclusively on the affection of nerves. What exactly Colocynth will do acting on nerves is what we'll be discussing. That will be one part. And second very important part that I'll be starting will be the action of Colocynth on the mucous membrane of JAT. See, when I started with Colocynth, I told you we homeopaths did not introduce Colocynth into the medical field. Colocynth was already used by the allopaths, and it was mainly used for, or it was mainly used as a purgative. But we homeopaths proved Colocynth, and we have shown to the world that Colocynth is not only a purgative, but it can also cause a lot of other affections. So focusing on the JAT, we'll just see what Colocynth will do. See now, I don't know which other GA remedies are over for you. And can you recall a few more remedies? As a second year student, I was told only 8 remedies are over. So comparing within 8 remedies might be a little difficult. Okay, Sina is one remedy, beautiful, very good. And we spoke a remedy in the last class, which again had a very important action on uh, JAT, which was that, yes, we also saw colchicum acting on JAT. Sina is a remedy acting on JAT. So what I am trying to tell you here is each remedy, this as a second year student, you should be very, very clear. Each remedy acting on the GI will cause its own complaints. You have Naxwamika, you have Sina, you saw Colchicum. Okay, they had their own symptomatology that will be coming up in provings, and which is also verified in our clinical practice. So what we are looking at here in Colocynth is Colocynth mainly causes colic. Okay, so I'll be mainly focusing on the colic part of Colocynth today. Okay, so To make things simpler, I will explain colic under certain headings. Hmm? So we'll also look at those headings under which the colic of Colocynth will be explained. See, the first very important thing which you should also cultivate is any problem a person comes to us with, there should always be a why, ailments from. Okay, and especially Colocynth is an acute remedy, so you'll definitely have exciting cause. Aphorism number 5, where Dr. Hahnemann talks of exciting cause. Okay, so now what are those causative factors in Colocynth because of which they will have colic? Okay, now this is what we call it as ailments from. See, to start with, anger. Anger is a very important causative factor you need to understand and you need to remember. Not only anger, I told you there are people with great sense of right and wrong, great sense of justice. So anything wrong happening can disturb them. So they might land up with a colic. So indignation, anger, mortification, chagrin, these are few things we have already discussed in the last class. For many it is a repetition, but these are all the ailments that will cause colic in Colocynth. So mortification, chagrin, indignation, vexation, eating unripe fruits. Which were the other ailments that were discussed? Can somebody quickly recall? I've given you the majority. Exposure to cold, good. Yes, Madhusudan, potatoes. Potatoes can cause colic in, Colocynth. And this is a common thing we all know. Meaning potatoes, they generally produce a lot of gas and it can cause colic also. Good. And few more inputs that are given. One more element that I'll be adding, and this is very specific for the colic part. Colic from cheese, colic from eating cheese, okay? And colic which comes up after eating and drinking. So colic which comes up after eating and drinking. Now, what will a Colocynth person do with pain? This is a quick question. The more quick you are, the more easy for us. It will be easy for us to continue the class. What will a Colocynth patient do with pain? Very good. They might lament. We uh, understood the meaning in the last time, in the last class. Yes, they might shout with pain. Beautiful. And what else will a Colocynth person do? Beautiful. Moaning. Now, just this morning, I had a case of a very young child, 3.5 to 4 years old child. Mother was complaining over phone that my child is sick, my child is having pain. And in the background, I could listen to the child with pain. She was moaning, Ayo, Amma, ah. The child was making some piteous noise because of the pain. And this is what we call it as moaning. See, if you know moaning or if you know the meaning and if you are very good at observation, though the mother is calling you and telling, sir, my daughter is in pain, I was more worried about what was happening in the background and luckily I got moaning. Luckily I could hear the child making those piteous sound and I got a symptom there, moaning pains from. So my case taking became very easy because we have only 14 remedies in our entire Materia Medica where a patient moans with pain. So my job becomes very easy because I have to select one among those 14 remedies. You're getting my point. So Colocynth moans with pain. Okay. So these are all the causative factors. Very good. I'm happy with your recall capacity. Good. So the causative factors and Then we look at the location. From your anatomy knowledge, abdomen is a huge area. And as you start studying surgery and the other allied subjects, you will realize the importance of location. If somebody has pain in right lumbar, left lumbar, hypochondriac, hypogastric, epigastrium, they will have their own pathology. In Colocynth, pain typically starts around the umbilicus and it moves up. Pain starts in the umbilicus and it moves up. So we are trying to understand we are trying to understand colic under different headings. The first heading we saw was ailments from what causes colic, and the second thing we are looking at is the location, where exactly they have pain. And the third very important thing is sensation. Okay. Now can somebody quickly interpret what is that sensation we have in Colocynth? What do you see in that topmost image? Uppermost image, what is it that you see? It's a simple image taken from Google Images, and you have to just, okay, overfilled stomach is what Neeraj says. Anything else that you can think of? Just looking at the image. See, you have a lady who is there in between, and there are two fat people, and they're trying to, she's been squeezed in between. I know, must be the food was little, what it was misguiding. They had food, they were eating food, that was a little misguiding. So what I wanted here, what I wanted you students to realize here is, there is a sensation. And remember, sensation is a subjective symptom, is a subjective feeling. So what is that sensation a Colocynth patient has is he feels the intestines are squeezed between the stones. You also have another image where I have tried to show you stones, but what you need to visually understand here is in Colocynth there is a sensation as if the intestines are squeezed between the stones. This is the sensation they have. So three small headings: ailments from, location, sensation. Okay. Now we look at a very important aspect of Colocynth. How is the pain? Okay. What is the character of pain you have in Colocynth? See, Colocynth, is something very, very important and interesting. Again, thanks to Google Images, at least we have that uh, we have the liberty to take, or we have the uh, knowledge, or we can take the images so that these images will have a better impact in the learning process. Okay, so see, this is how a Colocynth patient will come to you, or when you question the Colocynth patient, when do you feel better? Now this is what we call it as bending double. When they have a pain, they put pressure on their abdomen and they bend forward. Agonizing pains, which will make the patient bend double, is what is the symptom given in our source books. Agonizing pain in the abdomen causes the patient to bend double. Okay, and different types of pain. A patient might tell you it could be cutting, it could be twisting, tearing pains, and pains which come in paroxysms. Sudden pains. It will not be a continuous and constant pain. Sudden pains. And these pains are extremely violent. Extremely violent pains, pains which come in paroxysms, okay, and they are forced to bend double. This is very, very important. Okay. Must be if you go to third year, you will study a remedy by name diascoria. In diascoria, it will be exactly opposite. They have to bend back. Okay. I know you are in second year, but I am giving you a remedy from third year. It's a simple comparison. In Colocynth, they feel better by bending forward or bending double. In diascoria, they feel better bending back. Okay. So we'll go ahead. Violent pains. Where exactly Colocynth can be used? In our clinical practice tomorrow, in which condition can one think of Colocynth is again very important. It can be thought of in simple colic, or it can be thought of in ovarian colics. And one area where many girls get benefited from Colocynth will be dysmenorrhea, renal colic, or any colic when it has the symptomatology of Colocynth. When I say symptomatology, it should have an ailment, it should have the typical pain, where they are forced to bend double. Okay, so if you have this, you can think of in any other colic. Now we saw the location, we saw the sensation, then we are now looking at the modalities. When is the colic more in Colocynth? Aggravation. Okay. Two very important things you have: eating or drinking. Very characteristic in Colocynth. Eating or drinking aggravates colic. Okay. Now what ameliorates? What ameliorates? You already saw a very important factor there, bending double. Now bending double also tells us about another point, that is pressure. So pressure ameliorates, bending double ameliorates, and colic in infants and lying on stomach, they feel better. Now lying on stomach is, why do they feel better lying on stomach? Can somebody quickly tell me? Why do they feel better lying on stomach? Okay. Or when they uh, flex their legs towards stomach. Yes, it's pressure. Very good, pressure. And coffee relieves colic. Colic better by coffee. Colic better by pressure. Colic better by exertion. See, being a second year student, one remedy comes very close here, and that remedy is magnesium phos. In MacPhos, more than pressure, they feel better by heat. Many times we have girls with dysmenorrhea, and they have some hot fermentation, and then they feel better. They keep that hot water bag, they feel better. So in magnesium phos, pressure also ameliorates, I don't deny, but more than pressure, it is the heat that ameliorates. In Colocynth, more than heat, it is the double bending that ameliorates. Okay, Colocynth is predominantly left-sided and magnesium phos is predominantly right-sided. I'm just giving you a small difference between magnesium phos and Colocynth. Okay, so moving ahead, what we also have is associated with. So you know what I mean by concomitant. Okay, a symptom which is associated with the main complaint. Here we are discussing the main complaint, and the main complaint is colic. So with colic, what do we have? So colic is associated with diarrhea, there can be nausea, there can be retching, there can be vertigo, and there can be cramps in the calf muscles. Okay. So I hope it's clear. We just try to understand a component of Colocynth. ಇಲ್ಲಿ ನಾನು colic ಬಗ್ಗೆ I am just, see, retching is whack, like is something beyond nausea. Nausea is just that you get that vomiting sensation. In retching, even the muscles get active. You don't vomit, but then you just do that. Fine. Nausea is just that you feel nauseous. So retching, even the diaphragm and the other muscles also will get involved, and they go into bad contraction, and you start making those things that I just showed you. Okay. So I don't know whoever asked it. I hope I'm clear. Yeah, Neeraja. Hmm? Okay. So nausea, retching, vertigo, and cramps in coughs. Okay. So what we saw is we looked at the ailments we looked at the location, we looked at the sensation, we looked at the modalities, and we looked at the associated symptoms. But this is what Dr. Boningason calls it as a complete symptom. So a symptom which has a location, sensation, modality, and concomitant is called a complete symptom. Okay. Any quick questions here related to the colic of Colocynth? If you have any quick questions, no questions. Chalo. I mean, it's it's very simple and systematic. See, cramps in calf muscles will be an associated symptom in Colocynth. Must be if you look a little ahead, if you look into the remedy, this remedy also has a lot of diarrhea and wherein there is loss of electrolytes. Probably that loss of electrolytes might cause cramp in the calf muscles. This is what I can think of right now. But let me look into it. If I have a better answer, I'll definitely get back Madhusudan. Okay, fine. So, one second, there's one more question coming up. 1 second. See now, why? See now, very difficult part in Materia Medica is to answer many questions. See now, we are trying our best to make materia interesting, and we are making our best efforts to answer the questions with the help of anatomy, physio, pathology, and the allied subject knowledge. We are trying to make material more interesting. Okay, but why after eating, why after drinking might become a little difficult answer. Okay, but it is if you want me to answer it in a very simple way, it could be individualistic. Fine, and that is the speciality of Colocynth. Not necessary every remedy should have Colocynth. You'll have that. Okay, practically answering everything like this, why that might be a little difficult. But we are putting an effort to answer or to think why is this happening. See, these things come up in proving. Okay, so we'll have to look into the active principle, the sphere of action, a lot of things we'll have to look in, and then probably we'll get some answer somewhere. Okay, so we'll go ahead. Now I'll continue with GI. The last part that is left over in GI is diarrhea and dysentery, the rectal affections. So under rectum, what we see here is they'll have a severe urging for stool. So before going to stool, now before they get the urge, they'll have severe pain in the abdomen. Tenesmus, when they have that painful urging, they get bad pains and they feel like rushing to stools. And this urging, the moment they drink water, the moment they drink, or the moment they eat, they feel like rushing to the stool. See, there's something called as irritable bowel syndrome. In that also, a patient will have an urge to pass immediately after eating. But we can't prescribe blindly for all cases of IBS or for any other intestinal pathology unless you have symptoms of Colocynth. Okay, so severe tenesmus, pain, painful urging to pass stools, and these stools will be generally white, and stools will have mucus like scraping of intestines, jelly like mucus, frothy stools, greenish and offensive stools. Okay, so I need two remedies here, one in which the stool is white and the other remedy which has stools like scraping of intestines. Both the remedies are over for you. You have to just think and answer. Remedy dysentery like scraping of intestines. Which is the remedy? Which is the remedy which has what is this? Tools like scraping of intestines. So it means to say that you people are not studying after the remedy is over. Arnica is something different. We'll get back to Arnica after some time. Amruta R. After, Pragna, after so much of time, you say colchicum. As a teacher who has taught you colchicum, it's not a very nice and healthy thing. The moment I say scraping of intestines, colchicum would have come in. You can't take so many seconds to think and answer. Fine. So instead of saying good to all those who have typed colchicum, I'm sorry. I mean, I expected this a little more fast because colchicum is a remedy which we have already done. We have spent almost 3 hours. Okay. So me teaching, when I teach, things will be very nice. But when you have to reproduce those things, when that will be the real challenge. Okay. So anyway, very good. All those three girls who were answered colchicum. But I would have been happy if colchicum came the moment I said scraping of intestines. Next time, whenever the word scraping of intestines come, two minimum remedies should come to your mind. The first and foremost will be colchicum, and the second one is Colocynth. Okay. So now tenesmus means they will have the painful urging. They will have a lot of pain, and they have to pass stools. And this is something that you generally see in dysenteries, amoebic dysentery, bacillary dysentery, bad pain, and even while passing stools, they'll have bad pain. Fine. So tenesmus, severe pain with urging to pass stools. Okay. Fine. And somebody was talking of arnica. I don't know if arnica is done. Arnica will have different kind of stools. If is arnica done for you? Yes or no? Yeah. If arnica is done, what is the character of stools you have in arnica? Quick. If arnica is done, what is the kind of stool you have in arnica? Repeating the questions many times will not give you the answer, right? Probably that's what you're thinking. Sir, you repeating the question. I mean, okay. Now, what is it? How is it in arnica? See, arnica, we all know that is a very good remedy for injuries. Fine, but you'll be surprised that arnica also has something very interesting when it comes to stools. The stools, yes, there is dysentery. There will be a lot of time between two stools. They are sitting there in the commode, they pass stool, and there is another stool that is coming, but that stool will take a lot of time. So they have to wait long between two stools. Right? That's one symptom, very important during dysentery. And more characteristic, what you have is the stools in arnica will be flat. It will be ribbon-like stools. Okay. Now, why in arnica the stools are ribbon-like? Ribbon, I hope you understand. Right? Is flat. So you have this question: why arnica has flat stools or ribbon-like stools? One. And one more question that I had asked you was uh, white stools, meaning white mucus stool, which is the other remedy which has white mucus stool. So Ashwini has got it right. Long interval between two stools is what you have in arnica. My question to you was, which is the other remedy which has white mucus stools? Your books gives it as stools like popcorn. I didn't want her to use that word because next time when you're eating popcorn, you'll all feel disgusted. But that's how it is given in books. Next time you're in a theater and you feel like eating popcorn, and you'll be cursing me. This man will not even allow us to eat popcorn peacefully because there are stools which resembles like that of popcorn. Now the question is, which is that remedy which has stools like popcorn? No. Okay. So take this as an assignment. Yeah, there is a question mark. Neeraja, chamomilla. No, it's not chamomilla. In chamomilla, it can see chamomilla will have the stools which are more like greenish. It is offensive, like what egg, like rotten eggs, and it is greenish, offensive, and okay, fine. So they have taken it very sportively and they have told, sir, we will search and come back. So I'll not answer that question right now, but I'll be happy if you can search and get back. Stools, white, mucousy, popcorn-like stools. Okay, I don't know popcorn. We have different flavors. Way back it was only white. We'll not talk more. I know it's nauseating. We'll get back. So one small assignment will be, which is the remedy, which has tools like popcorn. Second thing is, why do we have ribbon-like stool in arnica? That's the second question. You need to, refer and get back to me. We'll continue with Colocynth. We'll talk of the last two small components. One with the last two components, the neuralgia. The neuralgia. See, like, I told you it's a remedy acting on the nerves. Which nerves Colocynth affects? Now I should start asking questions. I took it for granted, you know everything, and I was just going with the flow. But then you have reminded me, sir, very good. Yeah, long nose, good, very good. Long nose, sciatic nerve, trigeminal nerve, and spinal nerves. Very good, beautiful, good. Keep it up. Yeah. Anyway, some compensation there. Good. So trigeminal nerve, trigeminal neuralgia. So neuralgic pains when the pain from the face extends to the ear. Okay. So facial neuralgia and see prosopalgia. It's an old terminology for trigeminal neuralgia. I was happy one of your students was trying to tell me she's reading Kent's. It's a beautiful book. If you want to have a sound knowledge, please start reading good books. Kent's, fine, as a second year student, simple book will be Allen's Keynote for second years. As you grow up, Clark is a beautiful book, Boric is a beautiful book, E.F. Harrington, Fatux, they can slowly come up as you grow up. But minimum, you should know Kent and Allen's as a second year student. Okay, so take this statement very seriously. Kent's lectures and Allen's keynote, minimum you should know. Anything that you study beyond those two books, yes, it's a boon. So trigeminal neuralgia with eye symptoms are alternating with pain in celiac region with chilliness. So this is what you have in the facial neuralgia or the trigeminal neuralgia in Colocynth. Somebody rightly said sciatic nerve. So sciatic nerve, it's one of the longest nerves, and it runs a long course. So along the course of sciatic nerve, there's a bad pain especially on the left side. See, I have showed you an image there. VACE, vice. It's a tool. You know, when when things get compressed in between. Carpenters use this, and few of the other technicians might use this. So they have this sensation when something is crude there. That kind of feeling is what you have in Colocynth. And sciatic pains associated with numbness and pains aggravated walking, cold, lying down, movement, and night. And pains are better lying on painful side and pressure. Okay. Now, this will be the last part of Colocynth. Before I take up the last part, must be we have some time. See, as a second year student, the exams are also very important for you. Okay. So one common question that you expect from Colocynth is colic of Colocynth, which is usually asked for 5 marks. If you're lucky, they can also ask you a 3-mark question, and that 3-mark question will be neuralgia, or it can be ailments from, or it can be modalities. Okay, or it can be mind symptoms of Colocynth. Okay, so now these are all the aggravating factors: emotions, vexation, chagrin, anger, lying on painless side. Fine. See, when they lie on the painful side, they feel better. So lying on painless side aggravates night exposure to cold before and after urination. Okay. Again, it could be a very good remedy for urinary colic, provided it has those characteristic modalities. Okay. Heart pressure ameliorates. See now, the Colocynth patient will be so much in colic, so much in pain. They will be twisting, turning, and even pressing against something hard. They feel better. Like Dr. Clark says, pressing against the chair, some sharp edge, that pressure, they feel better. Hard pressure, heat, rest, gentle movement after stool or passing flatus. Flatus is gas or doubling up. You saw that, bending double. So these are the ameliorating factors in Colocynth. Okay. So if you have any questions, I'll be happy to take up. This is a simple remedy, and once I finish a remedy, please go back home, read so that things will be clear. And this, slide that I've shown will have value only when you read. Doubts will arise, questions will come up only when you read. Okay. Yeah, see, this is a remedy for sciatica. Pain along the sciatic nerve is sciatica. Madhusudan. The applied anatomy of sciatic nerve. Okay, yes, good. It's a remedy for sciatica. It is one of the remedies for sciatica. One of the top remedies for sciatica. Especially left side, I just gave you the indications of Colocynth in sciatica. Okay. So any questions before, I feel, yeah, we'll get a notification that we have 5 more minutes or 3 more minutes. So if you have any questions, quick questions, I'll be happy to take up. 4 more minutes. Yeah, the host, Chinmay. Yes. Any questions? Is the teaching clear? Because I never get this opportunity, never got this opportunity to ask you. If it was an offline class, we could have had a small interaction. Any area that you're finding it difficult, my language, the speed. If you have any issues, please tell me. I can accordingly correct and I can teach. But when I ask questions, please answer. That's very important. See, asking questions of the remedies that are already over. If you don't answer, then it will become very difficult. I'll be in a doubt. Are you following? Are you not following? That question will keep lingering. Okay. So once a remedy is over, you should be clear. You should be clear with the concepts. Okay. Other than sciatica, can we give this remedy, sir? What is this question? Okay. So yeah, neuralgic pains. Now, ophthalmic pains is what one of your friend wants to know. So basically, it's a remedy mainly for trigeminal neuralgia. You have something called as ciliary neuralgia. What your friend wants to know. See, probably yes in ciliary neuralgia, but there are tiny nerves. And if you look at the affinity of Colocynth, it is mainly for large nerves. Ciliary neuralgia, provided it's got those typical modalities, hard pressure, touch aggravates, but hard pressure ameliorates, or keeping anything warm, they feel better. Okay, and if it comes up after an anger, after some grief, fine. See, if it fits into the picture of Colocynth, you can definitely think of Colocynth. But mainly large nerve, so trigeminal neuralgia, sciatica, or the spinal nerves, they come into the picture. Ciliary neuralgia, I have no idea. I somewhere remember seeing it in Colosseum, but if you're very keen, next class I will just check and let you know. There are some 3 things even I need to look into. One is ciliary neuralgia. There was one more question somebody had asked. I told I'll check and let you know. Which was the other question? Somebody asked, I'm not sure. Let me just. You've given me some assignment. Some other constitute, yeah. Strumios, I don't know. I'll just check this. Sirisha wanted to know this. I'll check and I'll let you know. Any other questions? Anything else you would like to add or anything you would like to know about this particular remedy? Okay. If there are no doubts, then we'll close. Thank you for joining. And next Friday, I'm not there. One of my PG, colleagues, she'll take the class. And next Friday, I'll be taking class for you. Thank you.